Maxi Move is a mobile total lift for all healthcare environments. It allows for safe vertical lifting up to 500-pound patients in all care situations. The Maxi Move has two sets of controls to help the caregiver. One is on the mast and the other is on the handset. There are buttons to open and close the chassis legs, to raise and lower the hanger bar, and to tilt the patient from seated to supine. Before you approach the patient, be sure the battery is charged. Make sure the green power button is depressed and press the button on the handset or column mast. The indicator light will show if the battery is green and charged or if it needs to be replaced with the secondary battery unit. Also be sure that you have a sling available before you approach the patient. There are a number of sling sizes identified by the trim color on the sling. Yellow is medium, green is large, blue is extra large. The size of the patient's sling should be determined in advance and noted on the patient's assessment. Inspect the overall condition of the fabric and the plastic clip before use. Plastic stays provide head support for the patient. Be sure that all stays are in place with the sling. The caregiver should always tell the patient what they're going to do. Let's first look at lifting from a chair. Place the sling around the patient so that the base of the patient's spine is covered and the head support area of the sling is behind the head. Pull each leg strap under the thigh so that it emerges on the inside of the thigh. Ensure the positioning handle on the spreader bar is facing away from the patient and that the wide part of the spreader bar is at or just below shoulder level. You can use the raising and lowering buttons as well as the power DPS buttons to position properly. Ensure that the Maxi Move is close enough to be able to attach the sling shoulder clips to the spreader bar. To accomplish this, you may have to put the patient's feet on or over the chassis. Once the Maxi Move is in position, attach the shoulder strap attachment clips to the pegs on the spreader bar. Press down on the sit-up DPS button so the positioning handle on the spreader bar lowers and attach the leg strap attachment clips. If necessary, you can lower the spreader bar using the handset control, being careful not to lower it onto the patient. If this should happen inadvertently, there is a built-in cutout device which will prevent any further downward movement. Do not continue to push the handset lowering button. Once all four clips are fastened, you can raise the patient by operating the handset control. Apply the caster brakes to keep the Maxi Move in position on a sloping surface. Otherwise, the brakes do not need to be locked for lifting. Move the lift away from the chair. Press the recline button on the handset until the patient is reclining in the sling. This is the most comfortable position for transportation as it reduces pressure on the patient's thighs. The angle of recline can be adjusted to increase comfort for more restless patients. Before moving the lift to another area in the room, position the patient to face the caregiver at approximately normal chair height. This gives confidence and dignity and also improves Maxi Move's mobility. Transport the Maxi Move with the chassis legs in parallel or closed position, only so that they do not strike any objects while the lift is being moved. The Maxi Move can be moved from the caregiver front or from the side, whichever is more convenient. When lowering the patient back into a chair or transferring them to a chair from the bed, simply press the sit-up power DPS button to put the patient into a good sitting position. If the patient is being moved to a bed, open the chassis legs as needed to avoid any obstacles like bed casters. Place the patient in a reclined position and lower them down to the mattress. It may also be easier to place the bed in a semi-reclined position before lowering, as the sling will be easier to remove. Once the patient is lowered to the bed, unclip the 4 sling clips, raise the lift to clear the patient, and safely pull the Maxi Move out of the way. Return to the patient and remove the sling from under the patient by pulling it clear of the legs and pulling up from the back if the patient is in a seated position in bed or in a chair. If the patient is flat on the bed, remove the patient's sling by rolling the patient toward the caregiver. Please remember that if any handset button is released during the lifting or lowering procedure, powered motion will stop immediately. Also, when lowering the lift, Ensure that the patient's and caregiver's legs and feet are well clear of the moving mast. To lift from the bed, position the patient onto the sling by rolling the patient towards you, then folding the sling in half and placing it behind the patient's back. Position the sling carefully so that when rolled back, the patient will lie on the center of the sling. Check that the head support area of the sling covers the patient's neck. When rolling the patient back onto the sling, roll the patient slightly in the opposite direction so that the folded part of the sling can be pulled forward. Alternatively, the patient can be brought into a sitting posture and we can position the sling from the back and under the legs as we did from a chair. Approach the bed with the open side of the spreader bar towards the patient's head. Using the adjustable width chassis, it is possible to make adjustments to chassis leg widths to assist maneuverability around obstructions such as bed legs. Position the Maxi move so that the spreader bar is just above and centered over the patient. Tilt the spreader bar until the shoulder strap attachment points can be connected to the sling shoulder strap attachment clips. Press the power DPS sit-up button until the sling leg pieces can be connected. Connect the leg pieces under the thighs by lifting one leg at a time. You may need to lower the spreader bar a little. Again, take care not to lower the spreader bar onto the patient. When lifting from the bed, some caregivers prefer to connect the leg straps first. This applies in particular to patients with large thighs. In this case, raise the hip and knee into maximum flexion and attach the leg strap attachment clips. Then, tilt the spreader bar towards the shoulders for connection. Lift the patient using the handset control and adjust to a comfortable reclined position for transfer. The specially designed sling, together with its integral head support, enables one person to carry out the complete lifting function without additional help. Always check that all the sling attachment clips are fully in position before and during the lifting cycle and in tension as the patient's weight is gradually taken up. If returning the patient to a bed, move into the desired position above the bed, adjusting the sling position as necessary. Then lower using the handset control. Move the Maxi move away before removing the sling from under the patient. If transferring the patient to a chair, sit the patient up with the handset and lower the patient into the chair. Again, move the Maxi move away before removing the sling from under the patient. One of the most difficult manual patient transfer tasks is to lift a patient from the floor. With the Maxi move, this task is much safer and easier. To lift from the floor, put the sling around the patient as before by rolling or sitting the patient up. Depending on circumstances, space, and position of the patient, approach the patient with the open part of the chassis. Open the chassis legs if necessary and lift the patient's legs over the chassis. While the patient is positioned over the legs, do not operate the leg actuator. When connecting the sling to the spreader bar, the patient's head and shoulders could be raised on pillows for comfort if required, but this is not essential. With the open part of the spreader bar pointing down towards the shoulders, attach the shoulder strap attachment clips. Once connected, raise the hip and knee into maximum flexion and tilt the hanger bar by pressing the sit-up positioning button to connect the leg strap attachment clips. This will have the effect of raising the patient's head and shoulders slightly. If you prefer to connect the leg straps first, raise the hip and knee into maximum flexion and attach the leg strap attachment clips. Press the recline positioning button to tilt the spreader bar towards the shoulders for connection. When all the straps are securely attached, raise the patient from the floor in a semi-reclining position. Supporting the head can be comfortable and reassuring for the patient. Once raised from the floor, ensure the patient's legs are clear of the chassis before continuing to lift. The leg sections of the sling will tend to be fairly high in the crotch, so straighten them out for added comfort. The patient may then be positioned in a chair or placed on a bed. Patients with extensor spasm may be lifted by the Maxi move, but care should be taken to support the patient's legs during the start of the lift. When lifting patients with leg amputations, use the double or single amputee sling. There are two methods for weighing the patient, weighing before or after the patient is suspended in the sling. To weigh before, press the scale operating button. A display test is performed and all segments of the display are shown for approximately 1 second. The display will show weight and after several seconds will display the scale's current mode. Hang the sling to be used over the spreader bar and press the operating button again. The scale will display net 0.0. Remove the sling and position it around the patient as in a normal lifting procedure. Lift the patient until any obstructions are cleared, such as bed, chair, or floor, and the number displayed will be the patient's weight. The scale, once switched on, will operate for 6 minutes. After this time, the scale will automatically switch off. If this happens, press the button again. If you need to weigh a patient already suspended in the sling, ensure that the patient is suspended free and clear of any obstructions and press the scale operating button. The same display test will be performed. Ignore the weight displayed and press the operating button again. The scale will display net 0.0. Lower the patient to a suitable position and remove the sling. Hang the sling over the spreader bar. The weight is displayed, and although it will have a minus sign in front of it, this is the patient's weight. Let's talk about some other details of the Maxi Move. It has 2 rechargeable batteries and a charging station. The battery discharge indicator, located on the cover above the battery, shows how much power is left in the battery. It is best to change the batteries every 12 hours for maximum battery life. If the indicator shows amber, the battery should also be removed and charged. The Maxi Move is also equipped with an audible warning device which will sound when the battery discharge indicator reaches the red light range. To remove the battery, push the button at the top of the battery pack, then pull it out carefully. The second charged battery can be inserted into the lift by placing the bottom end first and then pressing the top end in until secure. To charge the battery, take it to the charging station, carrying it firmly by its handle, and plug into the charger. If the battery is very low, it will take approximately 8 hours to charge. The service meter displays how much the unit has been utilized, allowing usage monitoring, as well as a guide for important preventative maintenance schedule procedures. In the event that the handset and mast controls will not function, depress the red emergency lowering button to lower the patient as needed. The Maxi Move may be used to lower patients into a bathing tub if needed, as long as the bar is not submersed beyond the watermark as indicated on the bar. The Maxi Move bar can be removed and replaced with a 2-point bar for use with a walking vest or 2-point sling. The Maxi Move can be cleaned by wiping down with disinfectant. All surfaces should be wiped down between patients. Patient-specific slings, reusable slings, and many specialty slings are available for the Maxi Move. Reusable slings can be surface cleaned and laundered as necessary, while patient-specific slings are assigned to individual patients and thrown away after use. Maxi Move is a unique patient handling solution that can be tailored to improve the quality of care wherever passive lifting is needed.